And welcome to the Dr. Bob Show. Are you bothered with heartburn, acid indigestion? Do you know what's going on in the middle of your chest? Are you doing the right things or the wrong things? Are you eating the right foods? Are you exercising properly? Is your doctor helping you with GERD, reflux disease? Are they helping you with GERD causing hoarseness, reflux, cough, chronic aggravation of asthma, all of those things which are so important just from reflux disease from your stomach. My guest is Dr. John Haydek. Dr. Haydek is a board-certified gastroenterologist. He deals with GERD and how to treat GERD every single day. And he's going to be giving us tips from the pros to get rid of that heartburn in your stomach. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. And later on, we'll be talking about the importance of regular nutrition and exercise and sleep to help calm down your stomach and to help your stomach keep from dominating your life. A lot of information for you. You'll want to stay tuned. We're talking with Dr. John Haydek, board-certified gastroenterologist, stomach specialist, and we're talking about GERD. John, welcome to
Hello,
Dr.
Dr. Bob. Good evening to you.
What is GERD?
GERD, there's heartburn and there's GERD. Heartburn is a symptom like if you eat pizza, you feel a little burning, but it doesn't change anything. It doesn't affect your life. But GERD is a disease. GERD is where heartburn causes you to change something, like eat differently or take medication or do things in a different way, like raising the head of your bed.
So what are the symptoms then if somebody has esophageal reflux disease? It's a disease. What are the symptoms that somebody has?
Usually they have symptoms of acid burning coming up into their chest, but they can also have hoarseness. They can also have worsening of asthma. They can also have trouble swallowing. So GERD has typical symptoms, but it also has the atypical symptoms too.
What are the common symptoms that somebody has?
Eating spicy foods and feeling a hot water coming up into their chest, or feeling a burning, bloated feeling after they're done eating.
So that's pretty bothersome. Is it worse in the nighttime or worse during the day or all the time after you eat, before you eat?
I think it's mainly food induced. So if you're a normal American and you don't eat much in the day and morning, but in the evening time you eat a big supper with a dessert and lay down, you're going to feel it more at nighttime. Nighttime reflux is way worse than daytime. Daytime reflux, you're upright. Yeah. And if you have a little acid coming up into your throat, you'll make saliva, you'll swallow, it'll be pushed down and you'll be okay. But if you're sleeping, everything shuts off. So if you were to have acid coming up into your esophagus during the night, nothing happens. It just sits there causing injury. So daytime is better than nighttime.
If it gets worse at nighttime, are there special medicines that you can do or certain things that you can do to help nighttime reflux?
Well, the simplest thing is just not to eat for 2 or 3 hours before bedtime.
That's hard for me to do.
The second thing you can do is actually raise the head of your bed. So when you sleep flat, but you're upright, and it's harder for acid to go uphill when you're raised the head of your bed.
How do you elevate the head of the bed? Doesn't that make you slide down, or do you raise the headboard? What do you do?
I guess it depends how high you raise your bed, but if you raise it 2 or 3 inches, either with a 2x4 you could put at the top of your bed, or you could go and buy something called a wedge. It's from the healthcare stores. It's high at the head, and slowly goes down, and you can slide it underneath your half of the bed. So when you're sleeping, you're flat, but you're upright. The beds where it raises the head but not the feet doesn't really work as well.
So do people slide off the wedge? Is it a hard thing to get used to?
Because it's only 2 or 3 inches, most people do not slide down. They can stay upright.
Good. So a simple wedge can make a huge difference in somebody that has nighttime reflux disease?
Absolutely it could, and that's a simple thing, and it's not going to hurt them or expose them to medication. Not eating for 2 or 3 hours before bedtime and raising the head of the bed would be a great way to take care of it.
Are there certain foods that seem to cause more problems with reflux?
It's more of the fatty foods, greasy foods, and spicy foods. But if someone has a large hernia, or if someone was prone to reflux, then no matter what they eat, they tend to have issues.
So if somebody goes to bed at nighttime and they ate within an hour and there's still some food down in there, you're asking for trouble.
That's correct.
Now, how long does it normally take for food that you eat to get through the stomach so you don't get a chance to have reflux?
That is a great question. The average would be 4 hours.
Wow.
90% of your food empties your stomach by 4 hours, unless the food is fatty or greasy, and then it's much more delayed. So it would be so wrong to eat a big meal for supper and then finish that off with a nice fatty dessert and maybe an alcoholic beverage. You will easily worsen your reflux all night.
What does smoking do to reflux?
Well, smoking will cause a little bit more acid production within your stomach, but I don't think smoking is a major thing for reflux. It's more of the food induced.
They're down at the very bottom of the esophagus. We swallow food, it goes down to the stomach. There's a sphincter right there at the very bottom.
Correct.
That keeps food from going back up into the
That's
esophagus. Right. So does cigarette smoke relax that sphincter, or it's not as bad as some of the other things?
It's not as bad as some of the other things. The problem when people have reflux, it's either the sphincter doesn't work, either because there's a large hernia or it's gotten lax, or the sphincter works, it just inappropriately will relax at times when it shouldn't, when it should be tight after a fatty meal. In some patients prone to reflux, it'll just open when it shouldn't.
Is there one side you should lie on, or is it okay to lay on your back, or should you lay on your right side or lay on your left side?
The best way would be to lay on your left side. By laying onto your left side, you put the reservoir of the stomach in a downward position. If you lay on your right side, you put that reservoir above the stomach, and it tends to drain in.
And so you're setting yourself up if you sleep on the right side, if you eat before you go to bed, if you eat certain foods that are fatty foods, because it delays the emptying of the stomach. Is that right?
That would be correct.
Medications?
Oh, medications to cause reflux or medications to treat reflux, Dr. Bob?
To treat reflux.
To treat reflux.
Somebody's got reflux of food from the stomach back up the esophagus, and it's causing all sorts of problems. So what medicines help?
If it's mild, you would just take something like Maalox or Tums. If it's more moderate, you would take something called Pepcid or the new Zantac that's on the market, or Axid. Or if it's really severe, or if you really want good treatment once a day, there's something called the proton pump inhibitors.
Proton pump inhibitors.
Which would be Prilosec and Nexium and Prevacid.
Is that the top of the ladder?
That's the top of the ladder, the big guns.
Any problem with taking those for a long period of time?
The Google computer says yes, but the medical community doesn't look at it that way. There's very little proof that long-term PPIs hurt you, but there is some data out there that PPIs may cause strokes or bone loss or bacterial overgrowth. That data is weak, not strong.
Okay, that would be very significant if that was correct. But most gastroenterologists, stomach specialists, feel like that a proton pump inhibitor is a good medicine to take if you're getting more significant GERD reflux. Is that right?
That would be correct. People with severe reflux should be on a PPI. People who have mild reflux and don't want to give up their apple pie and ice cream at 8 o'clock at night before they go to bed would be a bad reason to take a PPI. So I think you use it for the people that really have to, but you try to rely on lifestyle modification if they could.
How do you make the diagnosis?
Well, the first one is clinical. You would talk to the patient and have them give you the symptoms or classic history. If there's warning signs, or if it's a white male that you're concerned about Barrett's esophagus, which is a precancerous change, then you may do an upper scope to give you some idea about the reflux. But it's basically a clinical diagnosis.
Is an EGD what we're talking about, to look down and see if
That
there's
would be
reflux?
what it is, an EGD.
That's what we're going to be talking about when we come back. EGD, esophago.
Gastroduodenoscopy, correct.
Done. Can't wait. We're talking with Dr. John Haydek, board-certified gastroenterologist. We're talking about GERD, gastroesophageal reflux disease. We've talked about heartburn, acid indigestion, that burning sensation behind the chest, and lots of things that we can do. A lot of things are lifestyle changes. A lot of things are maybe elevating the head of the bed, maybe not eating for 2 to 3 hours before you go to bed, using a simple antacid at bedtime to calm down the stomach when you go to bed. Sleep on the left side rather than the right side. 1, 2, 3. There's a lot of things that we can do to prevent the problems with heartburn, acid indigestion. Is that pretty much right so far?
That is perfect, Dr. Bob. Good job.
So good. Let's go on to, I don't know, I've been trying to do a good job, but I'm still having a gnawing sensation, heartburn and acid indigestion. Can you look down my esophagus and tell me what's going on?
So yeah, so we would say, well, so there's 2 types of acid reflux. There's a bad type where the acid is so severe that it burns your skin, causing these little scrapes called erosions. And then there's acid reflux where it hurts, but it doesn't cause burn marks, almost like hot water on your hand. It hurts, but it doesn't cause trouble.
How do you tell the difference between the two without looking down?
Well, you wouldn't know unless you look down. If you took 100 people who complain of reflux, only 20% get the burn marks. The other 80% don't. But you can't tell by symptoms. The only way you could tell is by looking, but we try not to scope people routinely, because scoping people really has risks involved with it. But that's the true way to be able to tell you severity.
So what's it like to do an EGD? That's where they look down the throat and they find out really what's going on. What's happening?
EGD is a very comfortable procedure nowadays with the help of modern sedation. We give a medicine called Diprivan or Propofol that makes you fall right to sleep. And while you're sleeping, we pass a scope about the size of a pen, and we look into the food tube, the stomach, and the first portion of the intestine called the duodenum.
What are you looking for when you look at those?
We're looking for acid burn marks. We're looking for scar tissue. We're looking for abnormal skin color called Barrett's esophagus, as well as stomach ulcers and things like that.
What is the burn marks? What do they look like? What's an erosion look like? What's the danger signs?
So your food tube is white, your stomach is red. That would be normal. And where they meet should be like 2 sheets of paper, white meets red. But with erosions, you'll get burn marks that are tracking upwards from the red stomach into the white esophagus, and they're really obvious because you'll see these red streaks within the white esophagus.
So what do you tell the patient that has the bad GERD, the bad kind? How do you teach the patient how serious this can be?
Well, the first thing you do is you correlate their symptoms with what's wrong. And many times patients don't have symptoms. They have asymptomatic GERD.
Wow.
So you make sure they know that trust the symptoms, but sometimes you can't. People with erosions, it's very important for them to take their medicine. If they go on vacation and miss their medicines, they need to go to the pharmacy and get some replacement. Whereas the non-burn mark people, whatever works to make them better, they should do. If it's Tums or Pepcid or apple cider vinegar, I'm not sure about that, Dr. Bob. Whatever works, they should take that to make them feel better.
And you have to take these medicines regular?
You should take them regularly. The people with mild trouble or the non-erosions can really get away with taking it more if needed, whereas the ones with the erosions, they need their medicine every day.
Let's talk about some of the side effects that you have if somebody has reflux. If they have acid that's coming from the stomach and it's going up to the esophagus, it's having little burn marks, it has little irritation of the stomach, it's getting secondary problems that are potentially dangerous, then what do you do for that patient?
Well, if you let them know that it's severe, and you get them on a good strong medicine like Prilosec or Nexium or Prevacid. One of the things you worry about with bad reflux with burn marks is the complications of acid reflux. And there's two types of complications. You can have complications within the esophagus, like esophageal stricture or scar tissue or bleeding or ulcer, or a funny precancerous skin called Barrett's. But you also have the complications of reflux that are outside of the esophagus. We call those extra-intestinal side effects. And that would be more like hoarseness, or coughing, or asthma.
The reflux comes up toward the vocal cords and causes people to have a rough, hoarse voice. What do you do for that?
Well, you be sure that you have them see a good ear, nose, and throat doctor first to be sure that the hoarseness is not related to anything else. Our esophagus is in the big picture, our esophagus is very tolerant. You could reflux up to 50 times in a day, and that would be normal.
Wow.
But a larynx can't tolerate that acid or bile or pepsin. Even little bits up to 3 or 4 times a day, even a burp that just brings up a little bit of acid into the vocal cord area can cause injury for a long period of time.
For a long period of time, it can cause that hoarseness, that irritation, that problem that we've got. When you've got reflux that comes up the back of the throat, it's near the back of the nasopharynx. Can it cause sinus disease?
That's what the books say. You could give sinus trouble, you can get dental enamel changes.
Wow.
But we don't tend to see that as much nowadays, Dr. Bob, because the medicines we have are so strong that if somebody is that severe that the reflux comes up into their mouth or up into their sinuses, almost assuredly they're seeing a doctor nowadays and they're being put on the strong medicines.
We see a lot of people with chronic cough because of reflux, and somebody is going all the time, all day, and it's because the reflux we feel causes cough 2 different ways. Number one, reflux can come up, go down toward the lungs and irritate the lining of the lungs. And then there's a reflex from the mid-esophagus that tells the lungs to go into spasm.
That's exactly right, and we call those J receptors, or at least that's what the pulmonary doctors call them, J receptors. At the very bottom of your esophagus, you have nerves, and those nerves are connected to your bronchial tubes. And in some people, if you stimulate the bottom of the esophagus with acid, it'll send a reflex up into your bronchial tubes that they better constrict, presumably because acid is coming down, and you can get some hoarseness and some wheezing.
When somebody has asthma that's having poor control, one of the first things that we're taught we better look at is somebody that's having reflux disease and get that taken care of.
That's exactly right. And again, in our day and age, just by giving them a strong medication trial for a month or so is so much easier than having to go through testing.
Weight loss?
Very important because it takes the pressure off.
Certain types of food, peppermint. Are there any special foods that I should stay away from?
Peppermint, caffeine, Inhalers, if you have asthma,
Too much hot stuff on pizza?
that'll certainly make reflux come up.
You know, a lot of times we want to experience food that have a hot, burning taste.
Yes.
And with that, we're adding coal to the fire of
That's
somebody
right.
that's got reflux disease.
That's correct.
Barrett's esophagitis, is it easy to see if you look down at the lining of the esophagus?
Extremely easy, because Barrett's is the same color as the stomach. And remember, we said the stomach is red, the esophagus is white. So with Barrett's, you have this red skin coming upward into the esophagus. It looks a little different than erosions or burn marks.
And that can be a precancerous lesion.
It is, not can be, it is a precancerous.
And that's what we're going to be talking about. The problems that we can get from quote, quote, simple reflux disease is not really simple. Chronic cough, aggravation of asthma, sinus disease, chronic hoarseness, Barrett's esophagitis, precancerous lesion, strictures that tie up, close down the esophagus, causes food not to be able to be swallowed down. We're going to talk about how you take care of Barrett's esophagitis. We're talking with Dr. John Haydek, board-certified gastroenterologist. We're talking about GERD, esophageal reflux disease, where acid comes back up the esophagus the wrong way, gets in the throat where it can cause hoarseness, it can cause actual sinus disease, it can cause changes in strictures and bad markings from acid burning the esophagus. And we've talked about what we have to do to try and get that better. There's one precancerous lesion that we need to spend some time on. It's called Barrett's esophagitis, and I want to spend the next couple of minutes talking about Barrett's and if there's a treatment for that. John, tell me about Barrett's esophagitis.
So Barrett's esophagus is where the stomach skin, where the bottom of your esophagus changes from normal white skin to the red skin, almost as if the stomach grows up into the food tube to help protect it. And that new skin growing up is not normal. We call that Barrett's, and it has a cancer risk. We tend to see it mostly in white males over the age of 50 with bad reflux that they're taking stomach pills all the time and have a little extra weight around their center. We call that central obesity. And that group of people, you could see Barrett's in about 7 to 10%. So we like to screen white men over the age of 50 with bad reflux, with central obesity, with an upper scope to look for Barrett's.
So when you see that, what's the treatment?
The treatment would be, one, making sure that there's no cancer cells that are going on right then and there. And number two, put them on strong stomach acid pills, which will, one, reduce the reflux, because the only way you get Barrett's is with reflux. So you put them on strong stomach pills to reduce the reflux, and there's a little bit of an anti-cancer effect built into the strong stomach pills, and it'll reduce your cancer risk.
Do you ever have to do surgery to help the area where the food comes back up?
If the Barrett's begins to go into cancer or pre-cancer or more worrisome changes, there's things we could do with our scope. We can cut out pieces called mucosa resection.
Wow.
You can burn the esophagus and make it go away, or burn the Barrett's by make it going away with ablation. So there's lots of things we could do. It's just you want to catch them early and get them on anti-reflux measures quickly.
Is weight loss part of that treatment?
Definitely. Weight loss is, because it takes the pressure off.
So John, one of the things that we like to do at the end of the Dr. Bob Show is talk about what we as people in the United States and in this area can do to stay healthy all the time. You have been so good at teaching us the problems that people have from reflux and how it can cause problems and what we can do for it. 4 things that we always say in the Dr. Bob Show. Number 1, it's exercise and activity. That keeps us at the weight we want to be, so our tummy won't push in and the food won't be pushed up toward the esophagus and cause some. 7.5 hours sleep. When we sleep, we're more productive people. The brain has time to rest. It has time to make decisions during the day. If I'm ever going to lose my temper, it's because, you've lost some sleep. So be sure that we get 7.5 hours sleep. The food that we eat is so important with reflux disease, and we need to concentrate on eating good food and proper food. And most of all, in the Dr. Bob Show, we want that laughter in your life. You know, it's amazing what laughter will do.
Yep.
When you find people that you love, you tell stories, you talk about fishing, you talk about your golf game, you talk about the children, you talk about gymnastics that they're doing, you talk about life in general. It has lots and lots of stories that make us relax, makes our blood pressure go down, makes us, when we eat, that the food digests better, and the whole body seems to work better. So exercise, 7.5 hours sleep, eating properly, and most of all, it's that laughter in your life. Sometimes I think we don't spend enough time with laughter.
That's probably true.
And one of the things that I like to do, and I think of Dr. John Haydek, is he always has a positive, bright-eyed appearance and helps people be happy and live longer.
And
John.
make people feel better too.
Thank you very much.
Thank you, Dr. Bob.